Hello, and welcome to your daily dose of health and medical news. Today is Friday, December 12th, 2025, and we're covering major strides in nutrition, global health policy, and cutting-edge medical algorithms. Here are the top stories making headlines. 1. The omega-3 gap, a global concern. First up, a major review highlights that most of the world isn't getting enough omega-3 fatty acids. The study, published today, reaffirms that adequate DHA and EPA intake, around 250 milligrams daily for adults, is vital for lifelong health, supporting brain, heart, and retinal development. Experts emphasize the need for consistent guidelines and sustainable sources, like fish or fortified foods, to close this critical nutritional gap. 2. New algorithm maps cell development. In research news, scientists at Sweden's Karolinska Institutet have developed a powerful new algorithm called multistage OT. This computational method can reconstruct the entire process of how stem cells specialize into different cell types, like neurons or immune cells, from a single snapshot. This breakthrough provides crucial insight into why this process sometimes goes wrong, potentially leading to new disease treatments. 3. UK and Singapore launch regulatory corridor. On the global front, the UK and Singapore are partnering to fast-track access to breakthrough health technologies. This first-of-its-kind regulatory innovation corridor allows companies to engage with both the UK's MHRA and Singapore's HSA simultaneously, aiming to cut approval delays and get life-saving innovations to patients sooner. 4. Today is Universal Health Coverage Day. Finally, today marks International Universal Health Coverage Day, an annual reminder that over half the world's population still lacks access to essential health services. The 2025 campaign theme, Unaffordable Health Costs? We're sick of it, urges global leaders to prioritize making healthcare accessible for everyone, no matter their financial situation. Dysthymia. Dysthymia, sometimes referred to as persistent depressive disorder, is a less severe form of depression, but the depression symptoms linger for a long period of time, typically years. Those who suffer from dysthymia are usually able to function normally, but seem consistently unhappy. WebMD. GLP-1 receptor agonists were linked to a small long-term reduction in vertebral fractures in a cohort study. The retrospective study was based on electronic health records of people with type 2 diabetes. Prospective studies are needed to confirm causality and elucidate underlying mechanisms. MedPage Today. What are the symptoms of stress? Stress symptoms vary greatly from one person to the next, but the most universal sign of stress is a feeling of being pressured or overwhelmed. Other symptoms include physical complaints, stomach aches, headaches, chest pains, nausea and diarrhea, and a sensation of numbness or tingling in your hands, arms, and face. Problems getting along with family members, friends, and teachers. Changes in behavior at home, short temper, unexplained anger, crying for no reason. Regression, behavior that is not age-appropriate. Dysfunctional sleep patterns, including nightmares, too little sleep, difficulty falling asleep, or even oversleeping, communication difficulty or personality changes, such as becoming withdrawn or requiring much more attention than usual. Impatience. WebMD. That's your medical news update for today. Stay informed, stay healthy. Please make sure to subscribe my channel for more health headlines. We'll see you next time. Disclaimer: use the content after verification.